Let's learn to give CPR to a child. It's not hard to do now that you know CPR for adults. Remember, you simply perform cycles of chest compressions and rescue breaths. We'll learn those separately and then put them together when you're ready. You will need a child mannequin and a CPR mask to practice. Be sure to get those before moving on to the next segment. Welcome back. We're now going to practice doing chest compressions on a child. Kneel close to your mannequin, near the chest. This time you'll be using a single hand to do the compressions. Put the heel of your hand on the lower half of the breastbone. Bring your shoulder up above your hand and keep your arm as straight as possible. Ready? Let's push with the beat. Here we go. Push hard, at least a third the depth of the chest, or about 2 inches. Push fast, at least 100 times a minute. Allow the chest to fully rebound. You're doing great. Keep your arms straight and use your upper body weight to push. Okay, stop. Let's do a set of 30 compressions from the start. Do them with me. Are you ready? Find your hand position. Let's start. 25, 26, 27, 28, 29, 30. Great. If you need more practice with compressions, this section can be played over again. Now let's practice giving rescue breaths to a child. It's very similar to that for an adult. Kneel next to the head of your mannequin. Look at your CPR mask to make sure the one-way valve is inserted and it is the correct size for the patient. Place the mask over the nose and mouth. Put your thumb and forefinger around the top of the mask and press lightly on the mask. Hook the bony ridge of the jaw with your fingers of the other hand and use your thumb on the bottom of the mask. Tilt the head and lift the chin to open the airway. This also brings the face up into the mask, which helps to create an airtight seal. Take a breath and blow through the valve opening. Each breath should last about 1 second in length and create a visible rise of the chest. See? No more than that, okay? Now let's practice giving 2 breaths at a time. Be sure to come up off the mouthpiece and take a fresh breath in between them. Ready? Do it with me. Let's try it again. You're doing great. Let's do a series of 2 breath sets. If you're still having problems getting chest rise, work on adjusting the airway or the seal of the mask. You can also ask your instructor for help. Ready? Here we go. Try not to overventilate. Be consistent. Excellent. One more set. Nicely done. If you need more practice, this section can be played over again. Are you ready to put it all together and perform CPR? Great. First, we'll go over the steps of assessing a child to see if he needs CPR. Before assessing, always make sure it is safe for you to approach. If a child appears unresponsive, tap or squeeze the shoulder and ask loudly, "Are you okay? Are you okay? Are you okay?" If the child is unresponsive, assess for breathing by quickly looking at the face and chest. If the child is not breathing or just gasping, have another person activate EMS and get an AED. Activate EMS and bring an AED. Then check for a carotid pulse in the neck. If no obvious pulse is found within 10 seconds, you need to do CPR. Let's try the assessment steps together. Are you ready? Are you okay? Are you okay? Activate EMS and bring an AED. He's not breathing and has no obvious pulse. CPR is the appropriate care for him until an AED or more advanced help arrives. Let's put it all together now. We'll check first to see if CPR is needed, and then we'll provide 2 minutes of compressions and breaths. That's 5 cycles of 30 compressions and 2 rescue breaths. If you get tired, it's okay. Take a rest. This section can be played over again. Are you ready? Here we go. Are you okay? Are you okay? Activate EMS and bring an AED. Well done. Congratulations, you now know how to perform CPR on a child.